First of all, I will deal with the inside of the calvaria. And you can see here the bones. This is the anterior aspect, the frontal bone. These are the two parietal bones and part of the occipital bone. The sutures here, like the coronal suture between the frontal and parietal bones, the sagittal suture between the two parietal bones, and the lambdoid suture between the occipital and the two parietal bones. The sutures here are not as clear as the sutures on the outside of the skull. You can see here on the outer surface of the skull, the sutures are very prominent. And this is expected because these sutures usually fuse from inside out. The fusion is by synostosis, and this fusion starts after the age of 30 to 40 years of age, and so they are not very clear on the inside of the skull. In the midline, there is a groove, a longitudinal groove, for the superior sagittal sinus, and on either side of the groove, and sometimes within the groove as well, there are depressions here. These are for the arachnoid granulations. The arachnoid granulations that drain the cerebrospinal fluid from the subarachnoid space into the venous sinuses. Laterally, you can see here, these are grooves for the meningeal vessels. And so these are the grooves for the middle meningeal artery, the anterior or the frontal branch, and the posterior or the parietal branch of the middle meningeal artery. In the inside of the skull, there are the three cranial fossae: the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. And as you can see, they descend like the levels of a staircase. The anterior cranial fossa is primarily made, the floor of the fossa is primarily made by this part of the bone, which is called the orbital plate of the frontal bone. This is another orbital plate of the frontal bone. It's a little bit concave upwards, and it's called the orbital plate because it forms the roof of the orbit. Here, this is the orbit, and the roof of the orbit is formed by this orbital plate of the frontal bone that forms the floor of the anterior cranial fossa. The other bone here is the cribriform plate of the ethmoid bone. This is part of the ethmoid bone called the cribriform plate of the ethmoid bone, and this bone is located at the roof of the nose, in fact. The other bone that forms the floor of the anterior cranial fossa is the sphenoid bone, part of the body of the sphenoid here, and the lesser wing of the sphenoid. So this is the lesser wing of the sphenoid bone here. Most anteriorly, there is the continuation of the groove for the superior sagittal sinus, and at the end of this groove, the lower end of this groove here, we can see a foramen, a small foramen, and this is called the foramen cecum. Actually, the groove ends as a flange of bone here, which provides attachment for the falx cerebri, the fold of dura mater that is located between the two cerebral hemispheres. And the falx cerebri afterwards continues its attachment to this flange of bone in the midline, which is called the crista galli. The crista galli is another part of the ethmoid bone. In front of the crista galli is this foramen, which is called the foramen cecum. It is called cecum because it is closed in life, actually. It is closed by the fibrous tissue, which is extension of the falx cerebri. We can see here on the orbital plate of the frontal bone that there are some ridges of bone. These ridges, generally, they look like a capital H, and these ridges, they conform with sulci on the inferior surface of the frontal lobe of the brain. Actually, this anterior cranial fossa is occupied by the frontal lobe of the brain. This is to show you the brain inside the cranial cavity. Here is the frontal lobe of the brain. This is the frontal pole. And this is the temporal lobe, and this is the occipital lobe of the brain. I will remove the brain, the cerebral hemisphere, and you will notice the anterior cranial fossa. It was occupied by this part of the brain, the frontal lobe of the brain, and on its inferior surface there are sulci here that are generally, these are called the orbital sulci and gyri, and generally they conform with the H-shaped ridges that are located on the floor of the anterior cranial fossa. Here you can see also, you can see the falx cerebri. This is the dura mater that is located between the two cerebral hemispheres. And note that the falx is attached to this frontal crest of bone here and to the crista galli. In between the crest and the crista galli is a foramen, which is foramen cecum. It is occupied by fibrous tissue of the falx. And here you can see the superior sagittal sinus that grooves the inside of the calvaria and extends forwards here as well as a groove. On either side of the crista galli, this is crista galli, on either side of it is the cribriform plate of the ethmoid bone. This cribriform plate has a lot of perforations, and that's why it is called cribriform. Cribriform means sieve-like. And these perforations are for the passage of the olfactory nerves. Actually, this part is at the roof of the nose, and the olfactory nerves, they pass from the nasal mucosa, from the olfactory mucosa of the nose. If we look at this sagittal section in the skull, here is the region of the nose. This is the lateral wall of the nose, and this is the roof of the nose here. At the upper part of the lateral wall of the nose and the nasal septum, and at the roof of the nose as is located the olfactory epithelium, from which arises the olfactory nerves, and these olfactory nerves will pass through the roof of the nose and make the perforations in the cribriform plate of the ethmoid bone. Posterolateral to the cribriform plate of the ethmoid bone is an impression, a flattened area that is formed by the olfactory bulb. The olfactory bulb is a collection of nerve cell bodies in the olfactory pathway. At the anterior end of the cribriform plate and on the side of the crista galli, there is a small slit, small opening, which is called the nasal slit. Here, you can see the nasal slit here. There's a small opening at the anterior end of the cribriform plate on the side of crista galli, and it transmits the anterior ethmoidal nerves and vessels. These anterior ethmoidal nerves and vessels, they arise in the orbit. Here, they arise in the orbit and pass through anterior ethmoid foramen in the orbit, where they appear in the anterior cranial fossa in the region of the side of the crista galli, and then they pass forwards through the nasal slit to appear on the face. The posterior boundary of the anterior cranial fossa is made by the lesser wing of the sphenoid bone. And this sphenoid bone, laterally, it unites with the frontal bone, with the temporal bone at the region of the pterion. Medially, the lesser wing of the sphenoid bone forms the anterior clinoid process. And just anterior to the anterior clinoid process here is the optic canal. This is the optic canal, which transmits the optic nerve and the ophthalmic artery. Of course, the optic nerve here is surrounded by its meninges, by its coverings. In between the two optic canals is a groove, and this is called the optic groove. The optic groove, which is located between the two optic canals, is related to the optic chiasma, but the optic chiasma does not lie in direct contact with the optic groove. It lies a little bit superior to it. The floor of the middle cranial fossa is formed mainly by the greater wing of the sphenoid, here is the region of the greater wing of the sphenoid, and by the temporal bone, the squamous and the petrous part of the temporal bone. In the middle is the body of the sphenoid. And in the superior part of the body of the sphenoid is a fossa, which is called the pituitary fossa, or the sella turcica. It is called the pituitary fossa because it contains the pituitary gland. And it's called the sella turcica because the region here looks like a Turkish saddle. Anteriorly, this piece of bone behind the optic groove is called the tuberculum celli, or the anterior part of the saddle. And posteriorly, there is a flange of bone here which forms the back of the saddle, and that's why it is called the dorsum celli. So the dorsum celli, pituitary fossa or sella turcica, and the tuberculum celli. The region here is also sometimes pictured as if it looks like a four-poster bed. And so these processes at the medial end of the lesser wing of the sphenoid are called the anterior clinoid processes. Cline means bed, like in a clinical, relating to a patient in bed. So these are the anterior clinoid processes, and lateral to the dorsum celli, on either side of the dorsum celli, are the posterior clinoid processes. These clinoid processes, they provide for the attachment of a sheet of dura mater, which is called the diaphragma celli. The diaphragma celli, it roofs the pituitary fossa and provides for the passage of the infundibulum, or the stalk of the pituitary gland. There is another clinoid process here, which is called the middle clinoid process. These middle clinoid processes are located at the lateral end of the tuberculum celli. The general shape of the region looks like a butterfly. This is the body of the butterfly, which is the body of the sphenoid, and the two wings of the sphenoid, the two greater wings of the sphenoid and the lesser wings of the sphenoid represent the four wings of the butterfly. The body of the sphenoid is grooved on its lateral side by an S-shaped groove here, and this groove is for the internal carotid artery. The internal carotid artery also is related to the anterior clinoid process, to the medial side of the anterior clinoid process. The internal carotid artery at this position is located within the cavernous sinus. So the cavernous sinuses are located on either side of the body of the sphenoid bone and the sella turcica. And they communicate with each other by intercavernous sinuses which pass through the sella turcica. And that's why these intercavernous sinuses, they form another constituent of the sella turcica as well as the pituitary gland. The internal carotid artery appears at the apex of the petrous temporal bone in this region above foramen lacerum. This is foramen lacerum here, and the internal carotid artery within the petrous part of the temporal bone has a horizontal course and appears at the upper part of foramen lacerum. It does not pass through foramen lacerum. No structure passes through foramen lacerum in life. It is occupied by fibrous tissue, save for some emissary veins. I will try to follow the internal carotid artery. The internal carotid artery enters the base of the skull at the carotid canal. Here is the carotid canal in front of the jugular foramen. And as the artery enters into the carotid canal, it changes its direction, becomes horizontal within the petrous temporal bone. So at this position, it is located within the bone, horizontally within the bone, and supposed to appear at this position. This is the foramen lacerum. The artery does not pass through foramen lacerum, but appears above foramen lacerum. So if we go into the inside of the skull now, we expect the artery to arrive or appear at this point in the upper part of foramen lacerum, and then passes lateral to the pituitary fossa. Here's the pituitary fossa. Passes lateral to the sella turcica and grooves the bone here, an S-shaped groove, and then ascends upwards, and it notches the anterior clinoid process, medial side of the anterior clinoid process. Here, the internal carotid artery is located within the cavernous sinus. In the floor of the middle cranial fossa, we can see that there is a crescent of foramina. Most posterior one is the foramen spinosum. Anteromedial to it here is foramen ovale. Foramen spinosum is called foramen spinosum because it is related to the spine of the sphenoid. It is a foramen within the greater wing of the sphenoid. Foramen ovale is oval in shape, and more anteriorly here, this is the foramen rotundum. And again, the derivation of the name is obvious because it describes the shape of the foramen. It is circular in shape rather than oval. So this is ovale, and here is rotundum. And the other foramen is located here. It's not a foramen, it is in the form of a fissure. So this is the superior orbital fissure. The superior orbital fissure is located between the greater wing of the sphenoid and the lesser wing of the sphenoid, and it is called orbital fissure because it leads into the orbit. Here you can see that the superior orbital fissure communicates between the middle cranial fossa and the orbit. Foramen spinosum is related on the base of the skull. It is related to the spine here of the sphenoid, and this is the foramen spinosum. That's why it is called foramen spinosum, because relating to the spine of the sphenoid. Foramen spinosum is the foramen that transmits the middle meningeal artery, a branch of the maxillary artery. This middle meningeal artery that grooves the skull and then divides into posterior and anterior branches. The anterior branch goes to the region of the pterion. Foramen ovale transmits many structures, but the most important structure that passes through foramen ovale is the mandibular division of the trigeminal nerve. The maxillary division of the trigeminal nerve passes through foramen rotundum, and foramen rotundum is a communication between the middle cranial fossa and the pterygopalatine fossa. The pterygopalatine fossa is a hidden region in the skull. We can see only part of it through the lateral side of the skull. Here is a fissure between the lateral pterygoid plate and the maxilla called the pterygomaxillary fissure, and the pterygomaxillary fissure leads into the pterygopalatine fossa. Posteriorly opens into the fossa is the foramen rotundum. Here again, this is foramen rotundum. It mainly transmits the maxillary division of the trigeminal nerve. You can see here the tip of the pointer you can see the tip of the pointer now in the pterygopalatine fossa. You can see it through the pterygomaxillary fissure. The superior orbital fissure transmits many structures, including the ophthalmic division of the trigeminal nerve, the third cranial nerve, oculomotor, fourth, trochlear, and the sixth, abducent nerves. Foramen ovale transmits the mandibular division of the trigeminal nerve mainly, but there are other structures that pass through foramen ovale as well. Among these structures, we have the lesser petrosal nerve. Here, at the upper part of the petrous temporal bone, we can see that there is a small groove on the medial side, and lateral to it, there is yet another smaller groove. This is a groove for the lesser petrosal nerve, and it is directed toward foramen ovale. The other groove here is the groove for the greater petrosal nerve. The greater petrosal nerve is directed toward foramen lacerum. Now we are concerned about foramen ovale. As I mentioned, that foramen ovale transmits the mandibular division of the trigeminal nerve. It transmits the lesser petrosal nerve. An accessory middle meningeal artery may also pass through foramen ovale. A nervus spinosus from the mandibular division of the trigeminal nerve that supply the meninges, as well as some communicating veins that communicate between the cavernous sinus here and the veins outside the skull, the pterygoid venous plexus. They pass through foramen ovale. Sometimes there are accessory foramina here, like an accessory foramen in front of the foramen ovale, which is called foramen of Vesalius, which might transmit these communicating venous channels. And sometimes there is another accessory foramen between foramen ovale and foramen spinosum. This is called foramen innominatum. It is not shown here in this specimen. And this foramen innominatum, when present, it transmits the nervus spinosus. The lesser petrosal nerve carries preganglionic parasympathetic fibers that are destined for the supply of the parotid gland. The greater petrosal nerve is directed toward foramen lacerum, and then it is going to pass through the pterygoid canal, where it's going to unite with the deep petrosal nerve and form the nerve of the pterygoid canal that synapse in the pterygopalatine ganglion within the pterygopalatine fossa. The postganglionic fibers are destined for the lacrimal gland and the mucous glands of the nose and pharynx. The posterior part of the petrous temporal bone here, as you can see, it is a little bit grooved by a narrow groove for the superior petrosal sinus. It's a venous sinus here that communicates between the cavernous sinus and the sigmoid sinus. And at the anterior end of the petrous temporal bone, between it and the clevus, there is another groove for the inferior petrosal sinus. The inferior petrosal sinus communicates between the cavernous sinus and the distal end of the sigmoid sinus here, where it ends as the internal jugular vein. At the tip of the petrous temporal bone, there is an impression here, and this impression is formed by the trigeminal ganglion. Actually, the trigeminal ganglion occupies this region, it impresses this region, and from the trigeminal ganglion arises, it's a sensory ganglion of the trigeminal nerve, and from it arises the three divisions of the trigeminal nerve. The first division, the ophthalmic division, pass forward to the superior orbital fissure, and the second division, the maxillary division, passes forwards and downward toward foramen rotundum, and the third division passes immediately downwards into foramen ovale. That is the mandibular division of the trigeminal nerve. So this is an impression here at the apex of the petrous temporal bone, is formed by the trigeminal ganglion, as well as the abducent nerve may groove the bone here at the apex of the petrous temporal bone. The main constituent of this fossa is the temporal lobe of the brain. Here is the region for the temporal pole and the remaining part of the temporal lobe. And we can see here that at the lateral end of the petrous temporal bone, there is a groove here where it joins the squamous part of the temporal bone. There is a groove and flattening area, flattening surface, and this flattened surface here is produced by the inferior temporal gyrus. Just medial to this impression for the inferior temporal gyrus, there is a ridge of bone here. This ridge of bone is produced by the superior semicircular canal. It is important to remember that this part of the temporal bone, the petrous part of the temporal bone, although it looks bony and hard, but the inside of it contains a lot of cavities. It contains the cavities of the middle ear and the inner ear, including the vestibule, the cochlea, and the semicircular canals, are all located within the petrous part of the temporal bone. This ridge of bone that is located medial to the groove for the inferior temporal gyrus, this ridge of bone is called the arcuate eminence. Now this is to show you how the temporal lobe occupies the middle cranial fossa. This is the temporal lobe and the temporal pole of the brain. They occupy the middle cranial fossa, and this is the inferior temporal gyrus that made the flattening of the bone on the superior surface of the petrous temporal bone. The posterior cranial fossa is bounded anteriorly by the crest of the temporal bone. This is the crest of the temporal bone between its superior surface and posterior surface. And posteriorly, the posterior cranial fossa is bounded by the groove for the transverse sinus. Here is the attachment of the tentorium cerebelli. The tentorium cerebelli, which is attached around this periphery, forms the roof of the posterior cranial fossa, and the grooves here are actually occupied by the cerebellum. The cerebellum is the main constituent or content of the posterior cranial fossa. In the midline is the big foramen, foramen magnum, and anterior to foramen magnum, this piece of bone is called the clevus. It is formed partly by the basio-occiput and partly by the basi-sphenoid. So it's partly of the sphenoid bone, partly of the occipital bone, and then these two parts of bone, they fuse together. Now this piece of bone, the clevus, is related to the medulla oblongata inferiorly and to the pons superiorly. And here we can see that there is a tubercle on either side, which is called the jugular tubercle. The jugular tubercle is in fact located at the boundary between the medulla oblongata below and the pons above. And just beneath the jugular tubercle, we can see an opening here, which is the hypoglossal canal, sometimes referred to as the anterior condylar canal, because it is located above the occipital condyle anteriorly. So this is the anterior condylar or the hypoglossal canal that transmits the hypoglossal nerve. As I mentioned, that the medulla oblongata is located or is related to the clevus beneath the jugular tubercles, and then the medulla oblongata passes through foramen magnum. Actually, it is the medulla and not the spinal cord that passes through the foramen magnum, and within the foramen it changes into the spinal cord. So this is to show you the contents of the posterior cranial fossa. You can see here that the fossa is not occupied by the occipital lobe. The occipital lobe is located above the fossa, above the tentorium. The main constituent here of the fossa is the cerebellum here, and anteriorly is part of the brainstem. That is the medulla oblongata and the pons. This is the pons and medulla oblongata. Also, you can see them here in this view. This is the cerebellum and the pons related to the clevus, so as the medulla oblongata also related to the clevus, but beneath the jugular tubercles. And here, this is the tentorium cerebelli in section. It forms a tent for the cerebellum and a roof for the posterior cranial fossa. Note at the junction of the tentorium cerebelli and the crus cerebri, the tentorium cerebelli comes horizontally and the falx cerebri is vertical. At the junction of these two folds of dura mater, there is the straight sinus. So this is the straight sinus. Posterior to foramen magnum, there is a crest of bone here, which is called the internal occipital crest, as opposed to the external occipital crest on the outside of the skull. This internal occipital crest provides attachment for the falx cerebelli, which is a flange of dura mater that is located between the two cerebellar hemispheres, and it encloses the occipital sinus. Now, at this point here is a protuberance, a big protuberance. This is the internal occipital protuberance as opposed to the external occipital protuberance at the outside of the skull. And you can see here that diverging from this protuberance, there are some grooves. So if we look above the protuberance, in other words, here we are in the, these impressions here are for the occipital poles of the brain. We are in the region above the tentorium cerebelli. And the groove, there is a groove here in the midline, which is the groove for the superior sagittal sinus. You notice that the groove for the superior sagittal sinus continues and becomes horizontal. It continues with the right transverse sinus. This is the groove for the transverse sinus here, and this is the groove for the left transverse sinus. The superior sagittal sinus usually continues with the right transverse sinus, while the left transverse sinus represents the continuation of the straight sinus, the sinus that I have just mentioned, located at this position, and it is located between the falx cerebri and the tentorium cerebelli at the junction of these two sheets of dura mater. If we follow the transverse sinus and its groove here, we see that the groove continues as a S-shaped groove, which is the groove for the sigmoid sinus. And here there might be an opening for an emissary vein that communicates with the vein outside the skull. This is called the mastoid emissary vein. The sigmoid sinus, as you follow it, it leads into the jugular foramen. So this is the jugular foramen. It's a big foramen here. It's located, it's not a foramen in a single bone, but notches in two bones, the petrous part of the temporal bone and the occipital bone. So the foramen is located between them. And evidently here, this foramen contains the jugular bulb, which is the continuation of the sigmoid sinus. It will be distended as a bulb, and then the jugular bulb continues as the internal jugular vein. The same is true on the other side. Of course, the jugular bulb is not the only structure that passes through the jugular foramen, but the jugular foramen allows for the passage of the 9th, 10th, and 11th cranial nerves, the glossopharyngeal, the vagus, and the accessory nerves pass through this foramen as well. And you can see here on the side of the clevus that the inferior petrosal sinus drains into the jugular bulb, while at the crest here of the petrous temporal bone, there is a groove for the superior petrosal sinus that drains into the sigmoid sinus. On the posterior part of the petrous temporal bone, there is another opening here. This is the internal acoustic meatus. We can see it now better. This is the internal acoustic meatus, and the internal acoustic meatus transmits two of the cranial nerves, the facial and the vestibulocochlear nerve. It is clear that the vestibulocochlear nerve that supplies the vestibule and the cochlea should pass through the petrous temporal bone, since these structures are located within the petrous temporal bone. So this internal acoustic meatus transmits the facial nerve. The facial nerve has a complicated course within the petrous temporal bone, and then it will leave the petrous temporal bone through the stylomastoid foramen here, between the styloid process and the mastoid process. This is where the facial nerve leaves the petrous temporal bone. while the vestibulocochlear or eighth cranial nerve will supply the vestibule and the cochlea within the petrous temporal bone. Together with these two cranial nerves also passes the labyrinthine artery that supply the labyrinth, the bony labyrinth of the inner ear cavity. In this sagittal section of the skull, I will go rapidly through some of the features. I would like to show them better. Here you can see anteriorly is the frontal bone, and within the frontal bone you notice that there is a sinus. This is an air sinus. This is the frontal air sinus. And here this is the ethmoid bone. These are some of the pieces of the ethmoid bone, like the cribriform plate of the ethmoid bone, the crista galli. And within the ethmoid bone you can see the ethmoid air cells, the group of air cells that will form the anterior, middle, and posterior ethmoid air cells. This is the sphenoid bone, the body of the sphenoid. Notice here that the body of the sphenoid, superiorly, it is grooved or by the pituitary fossa, and the body of the sphenoid is occupied by the sphenoid air sinus as well. This is the region of the clevus here, where it is related to superiorly to the pons and inferiorly to the medulla oblongata. And this is the occipital condyle. Above the occipital condyle is the opening for the hypoglossal canal, or it is also called the anterior condylar canal. In the middle cranial fossa, you can see the foramen spinosum, foramen ovale, foramen rotundum, and the superior orbital fissure here. This is foramen lacerum. And notice that since foramen spinosum allows the passage of the middle meningeal artery, you can follow the groove of the artery on the bone. This is the artery here. It's dividing into posterior branch and anterior branch. The anterior branch passes toward the region of the pterion, where it deeply notches and sometimes also tunnelizes the bone at the region of the pterion here. This is the crest of the petrous temporal bone, where it is grooved by the superior petrosal sinus, and this is a groove for the inferior petrosal sinus. Here is the internal acoustic meatus, and this is the jugular foramen here. It's a big foramen, and you can follow the sinus, the venous sinus, towards it. Here's the internal occipital protuberance. This is the transverse sinus here, and here is the foramen magnum.